Hello, you are welcome. Today we are discussing cranial nerves. So we are saying cranial nerves are a set of 12 nerves that originate in the brain. Each nerve has a different function, responsibility, that is either sense or movement. Some are even mixed. The following are the cranial nerves. The first one is the olfactory nerve. So olfactory nerve, these are nerves of the sense of smell. The second cranial nerve is also a sensory nerve called the optic nerve. So these are nerves of the sense of sight. The third cranial nerve is the oculomotor. It's a motor nerve. Okay, so the oculomotor nerve helps control muscle movements of the eyes. The oculomotor nerve supplies 4 of 6 extrinsic muscles which help move the eyeball. The superior, so these muscles are the superior, medial, and inferior recti. Also the inferior oblique muscle. They also supply the intrinsic muscle, which is the ciliary muscle. The oculomotor also supply the levator palpebrae muscle. The fourth cranial nerve is the trochlear nerve. So these are nerves which arise from the nucleus near the cerebral aqueduct. They supply the superior oblique muscles of the eyes. The fifth cranial nerve is a trigeminal nerve, which is the mixed cranial nerve. So the trigeminal nerves are among the largest cranial nerves and has both motor and sensory functions. The trigeminal nerve has 3 branches. So the 3 branches are the ophthalmic nerves. These are sensory only and supply the eye, the forehead, and the mucous membranes of the nose. The maxillary nerve. These are sensory only and supply the cheeks, the upper gums, upper teeth, and lower eyelids. The mandibular nerves. These are both sensory and motor. They supply the teeth and lower jaw gums, lower lips, and tongue. The motor fibers supply the muscles of mastication. The sixth cranial nerve is the abducens nerve, which is the motor nerve. These they supply the lateral rectus muscles of the eyeballs, causing abduction. Okay. The seventh cranial nerve is a mixed nerve, which is the facial nerve. So these nerves are composed of both motor and sensory fibers. The motor fibers supply the muscle of facial expression. The sensory fibers convey impulses from the taste buds in the anterior tongue to the taste perception area in the cerebral cortex. The eighth cranial nerve is the vestibulocochlear nerve, which is a sensory nerve. This nerve contains 2 components, the vestibular nerve and the cochlear nerve. So the vestibular nerve, this helps the body sense changes in position of the head with regard to gravity. This helps the body maintain balance. The cochlear nerve, this originates in the spiral organ, the organ of Corti, and convey impulse to the hearing areas in the cerebral cortex. Okay. So vestibular nerve, balance, cochlear nerve, hearing. Okay. The ninth cranial nerve is the glossopharyngeal nerve, which is a mixed cranial nerve. Okay. So the motor fibers stimulate the muscles of the tongue, pharynx, and the secretory gland cells of the salivary gland. The sensory fibers convey impulse to the cerebral cortex from the tongue, tonsils, and the pharynx. Okay. The 10th cranial nerve, which is a mixed nerve, is a vagus nerve. So the vagus nerve has different functions. Okay. Providing motor, sensory, and parasympathetic functions. So the sensory part provides sensation to the outer ear, throat, heart, and abdominal organs. They also help in taste sensation. The motor part provides movements to the throat and soft palate. The parasympathetic function regulates heart breathing and many more. The 11th cranial nerve is the accessory nerve, okay, which is a motor nerve. Okay, so the fibers supply the sternocleidomastoid muscle and the trapezius muscle. Branches join the vagus nerve and supply the pharyngeal and laryngeal muscle. The 12th cranial nerve is the hypoglossal nerve, which is the motor nerve. Okay, so this nerve supply the muscles of the tongue,